6, halting and reversing the spread of HIV, have been achieved and exceeded. This is according to a new report released by the United Nations Programme on HIV-AIDS and from the UNAIDS. For more on this, we are joined by Dr Fareed Abdullah, CEO of SANAC. Doctor, good morning. Thank you very much for joining us from our Pretoria studios. Let's just unpack this quickly for our viewers. What do we mean when we say that the targets of MDG 6, halting and reversing the spread of HIV, has been achieved and exceeded? Good morning.
Good morning. So the main thing is that a target was set in 2000 to put 15 million people on antiretroviral treatment in the world, and we're very pleased to announce that this target has been met. This is a remarkable achievement. In fact, it's probably one of the biggest achievements in global health over the last 2 decades.
Doctor, take me back. How did we get to this point? How did we make sure that we not only met the target, but we exceeded it?
So the first thing I'd like to say is that this was a global effort. All countries worked together. UNAIDS played a leading role, and the donor governments and country governments made significant financial contributions. In 2000, it was seen as almost an impossible target to meet because antiretroviral treatment cost $10,000 per person per year. Now it costs less than $100 per person per year. The health system infrastructure was not set up for this, so a lot of work was done in countries. But mainly it was a global effort by doctors, nurses, AIDS activists, and now at least we can be proud of one achievement globally, and that achievement is the 15 million, of which I'm happy to say South Africa contributes a whopping 20%. We now have 3 million people on antiretroviral treatment in this country, and we can be proud of what we have done as a country, our government, NGOs, and AIDS activists.
Doctor, also talk to me just from a South Africa perspective as well. A lot of the focus over the last couple of years has been mother-to-child transmission and the kind of progress and the inroads in making sure that that South Africa is arguably one of the leaders in that forefront.
Yes, I think once again this is something we can be proud of. Sam, without treatment, 30% of mothers would have passed the virus on to their babies. And in South Africa, that figure is now 2.6%. It's a 90% reduction in transmission from mother to child. And this has also happened in many other countries in the world, but certainly one of the best achievements in this country, and we can once again be proud of that.
Doctor, we don't often talk about it, but we know that there are massive efforts on the ground, in communities, in community halls, around educating, around talking about living with HIV. How much has that played a role in people understanding the importance that medication plays in fighting HIV?
The community response in South Africa has been phenomenal. But I must say, Sam, at this point, we are actually only halfway to where we want to be, because as the UNAIDS report says, there are still 2 million new infections every year. In South Africa, we have almost 350,000 new infections last year. So we have to do a lot more when it comes to prevention. And the UNAIDS report, whilst it extols the achievement, it also says that we have a lot more work to do, and it sets new targets for us to reduce new infections by 2030. This is in keeping with our plans in South Africa as well. So whilst we have made an achievement, it's important to know that we also have a long way to go for the next 15 to 20 years.
Doctor, we're going to leave it there, but thank you very much for joining us from our Pretoria studio. That was Dr. Abdullah Fareed, CEO of the South African National AIDS Council, talking to us about the newly released report on the AIDS targets of MDG 6, halting and reversing the spread of HIV that has been achieved and exceeded. Let us know what you think. It's Morning Live at sabc.co.za.